She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
Oh, and I love to talk about all the things health, and I've got someone here who's an expert in metabolism and health, because I think you have your own testimony. Did you lose weight did you make this discovery because of your own personal weight loss?
Absolutely. I think most clinicians who are in this field and they're very passionate about it, they do it because they've gone through a personal experience. I'm traditionally a trained doctor and never really thought about nutrition beyond the whatever we're told.
Oh.
But at one point in my training, I had gained over the years 35 plus pounds, had developed high blood pressure. I had chronic back pain, muscle spasms, back spasms, give out my back all the time, and even became significantly insulin resistant. I thought I was headed towards diabetes if I continued like that. Sluggish, weak, I just thought it was work and being in training. But then I decided to dive into my health and try to lose weight initially in a superficial way. Maybe that would help my back, but that ended up in a 4 or 5 year journey of really changing my mindset about a lot of stuff, from nutrition. So when I started changing my diet, eliminating junk food, carbohydrates, sugar, my energy picked up, my weight started falling off, my back pain disappeared. So a lot of my blood pressure went away. And this became kind of that journey that took me from traditional to believing nutrition as really this should be the cornerstone of the treatment.
Well, when you run for president, I'm voting for you because that's what I want. That's what I want the platform to be in 2024 is somebody who will present to us the fact that calories in, calories out is fallible. I mean, I know laws of thermodynamics, so I'm not going to get into that. But in the big picture, it's our nutrition is kind of going back to basics. So what was the first thing you did to mitigate your health? Because it's a health situation, not just weight. It's a health situation.
Right. Well, right now I have the benefit of hindsight, but at the time I was just hopping on whatever was popular. And that 2014, 2015, there was a Whole30 program. It's still very popular. So I read the book of Melissa Hartwig, and then that made a lot of sense to me. I was like, I should have known this, but really it didn't translate clinically. That we never practiced like that. So I figured, let me just clean up my diet, do that 30-day trial, and in 30 days it was like night and day. I went through withdrawal. I was like, what is this? I feel hungry, I'm craving things, I got headaches. But after a week or two, getting used to it, I felt like high energy. I lost 15 pounds in the first month. Wow. Just like off the bat. And I didn't know how slowly I gained the weight. It was 2 to 3 pounds a year over 10 years, and it adds up. So when I lost 15 pounds quickly and my pants were falling off, okay, let's see. So I did it another month, and then I lost another 10 pounds. So it was like 25 pounds in 2 months. So that was a major wake-up call. Basically eating real food. I was still eating a bunch of carbohydrates.
Who knew that real foods could feed us?
Yeah, exactly. I was like, but hold on, I'm eating like meat and butter, and I was dairy free at the time because Whole30 is more paleo, so I just kind of stayed off dairy. But I didn't. Right now it's kind of I eat it, but at the time just eliminating all that stuff. But I was still eating sweet potatoes, vegetables, meat, and stuff like that. So inflammation just went away from my body. Like I knew it, I felt it. Like my back wasn't tight, I wasn't hurting, and that's how it started, really.
So the great thing about Whole30 is, for those of us health coaches, and we always tell people to love the foods that love you back. It starts you on that journey because you start realizing that though wheat is a wonderful product, it's really inflammatory, and so there's no wheat. I would say the first thing that is removed from that is processed foods and then wheat products. So you think of bread, pasta, and some other things. Have you been able to reintroduce that into your diet, or do you just stay hands off?
I'm not like I'm 80-90%, whole nutrition, animal based, of
Yeah.
grain free, all that stuff. But I mean, occasionally there's a good sourdough, there's some rice when I eat
Right.
sushi. I'm not like, I don't have that dogmatic approach to my own health. But during the process of losing weight, getting healthier, I was more strict. I like the structure of Whole30. The psychology of food was the biggest part of that program, where not, I always look for dessert. And then you can easily find dessert that is keto, that is paleo. And that mindset, I had to divorce myself. And then I learned a lot about food labels and reading, and realize how much sugar is in everything. But eventually, I did the Whole30, paleo, keto, carnivore, and I kind of now I eat some fruit and things like that. So I eat grains, but when I do, I never feel great, and so I pick sourdough bread if I do eat it, and I eat it rarely. If it's something like I know it's really good, I may make an effort, but I really limit myself because I'm very conscious of what I'm eating. But generally, I avoid that stuff right now.
Do you feel like are you Lebanese? Are you're
Yeah, I
from
am.
Lebanon? So I
Yeah.
love Middle Eastern foods are some of my favorites.
Yes.
So then do you stay away from bulgur wheat and baklava because that's the food of your ancestors?
Right. So bulgur wheat, I mean, it's such a small amount. When they make this raw meat, minced meat, or cooked or whatever,
Yep.
it's really just like a shot of alcohol of bulgur wheat. So
Yep.
I try not to. If I can avoid it, I will. But if it's there and I didn't notice it's making a big impact on me. But pita bread, these sweets, I really stay away from them as much as possible. If I do, I make it very limited. I was never a big fan of baklava, luckily, but there's a lot of dairy-based desserts, like sweet stuff.
Well, I'm hanging up now if you didn't like baklava. I mean,
It's just, I always thought it was way too sweet with the sugar syrup
it
on
is.
I would have, I guess I was lucky I could moderate. I can eat one piece or half a piece and be done.
I guess that's an option.
Right, that is an option. But like I know my family, my brother, he can polish off the whole
Yeah.
tray
Right.
if he doesn't stop himself. So
Well, then let's talk about the metamorphosis then of the food culture, because in Lebanon 100 years ago, the wheat wasn't genetically modified, and it probably didn't make people ill. And now, because they'll say even in India, there's still parts of India where naan bread is served, and it doesn't bother the
right.
natives because they're not using American glyphosate wheat. So don't you think then that our industrial revolution and our modern society has kind of damaged some of the things that used to be so pure and so good for us?
Absolutely. I mean, and this is when we started declining from the Industrial Revolution, and the more they refine and try to increase production and modify genetics and things like that, it became a foreign substance. It's not
Right.
even food anymore. I have people eat gluten right now. They can blow up 10 pounds in a week. They didn't gain fat in 10 pounds. They just get so inflamed and swollen, especially after they cleaned up.
Yeah.
And that happens to me too if I went on a trip and I indulge it a little bit more. But more so in the US, when I'm overseas, it seems to be a little bit less inflammatory than here. I'm sure there's many reasons, but even like in Lebanon, pita bread became a little bit more inflammatory. But there's more traditional bread that are thin. The wheat is not as
Right.
That bread, I eat it. I don't really feel bad. I don't eat it a lot, but So there's this kind of a mixed bag. But obesity and diabetes is just as bad over there. It's getting worse. And
Is there a DNA link? There used to be a study that said Asians and Hispanics had higher rates of type 2 diabetes, even more than Westerners or Americans. Is that still
Yes.
a statistic that's true today?
I haven't caught up on the statistics, but I know they have a higher risk. Genetically, they're more predisposed, and I think because historically or ancestrally did not have that much exposure to this type of food. And I think
makes
Native
sense.
American specifically, they basically lived on meat, and I don't know if they ate tuber, but it was really until they got exposed to the Western diet that they start getting. They're getting destroyed health-wise, and it's really sad to see that. Middle East has a huge increase of diabetes, and a lot of them don't become obese like we see in the U.S. They have this little bit of belly, Some of them become obese, but generally you don't see obesity as extreme as the US, but that means they can't gain a lot of fat. They become diabetic sooner. That makes it even more dangerous.
Because we're talking not about what the number is on the scale, but your metabolic health. And we know 88% of us are not metabolically fit. So a lot of people will say, oh, my doctor didn't say anything because my BMI is this, but it's a much bigger picture than that.
Yeah.
What are some of the, so this is, I'm a certified health coach and a lover of all things intermittent fasting. So that's kind of my perspective on this, but lab tests. So you come through the internal medicine, diagnostician, and nephrology, right? So boy, that's what's so amazing. Dr. Fung, his whole approach to intermittent fasting was based from a nephrologist point of view of end stage renal disease. And these people are coming in going, well, I'm doing everything I'm told. And nothing is changing. But from your perspective then, because I think there is an importance with some lab values, because I think fasting insulin is a miraculous view into your metabolic health. But what are some other things? There's C-reactive protein, but then there's C-peptide, right? Those are two different things, right?
So C-peptide is, so insulin, when your body makes insulin, it makes it a precursor that has a C-peptide and it gets clipped off. And then, so fasting insulin and C-peptide, for most people, you can use either or as long as you understand the unit. Okay. You're probably good, but C-peptide becomes more important to measure if somebody is already on insulin or a type 1 diabetic, to see if they're actually making any insulin, native insulin. Then C-peptide, because it's not in the insulin injection, you can pick that up. Dr. Camberry likes C-peptide a lot. I mean, I have no problem against it. I just find it a little more expensive than fasting insulin, and I use fasting insulin more often than C-peptide.
So because you're the clinician and can order it, I have a lot of clients who get pushback from their provider who'll say, we're checking your glucose and A1C. And I go, no, I need your fasting insulin. But it's sometimes a battle. Is that an insurance paradigm, or is it just the providers uneducated?
I think it's provider not understanding what that means, what to do with the number. And there's no pill for high insulin. The way I describe it to people, it's like tip of the iceberg. When you have diabetes, you're seeing the top, and then it's a big problem. When A1C falls into normal, you're at the water level. You don't know how big the problem is beneath it. So insulin is what kind of gives you a view under the water. Clinically, I never ordered it. It was rarely ordered except by some endocrinologists in rare cases of trying to discover a problem. So they haven't really ordered it before. But right now I depend on it. Honestly, it's kind of predictable who's going to have it. So I haven't been majorly surprised in general. And then the other things, what I've noticed over the years, and we underreported or we ignore it, is like fatty liver, visceral fat, things like that. That's a huge number. You get a lot of people scanned in the hospital for different reasons. And the impression may say normal scan, but when you look at the details, fatty liver, infiltrated, increased visceral fat, it just becomes so common that becomes almost normal to expect that, and nobody mentions anything. But that's the biggest opportunity to really make a difference before it becomes diabetes and all that stuff. So insulin is one.
Well, insulin, after I read Dr. Bickman's book, Why We Get Sick,
it
totally changed my perspective. Now it's like I now get it. I just get it. So Dr. Hyman says he likes a fasting insulin of 5 or 6. What's your sweet spot?
In an ideal world, I like it less than 4.
Less than 4.
Mine is 2 to 3. I've seen people.
Mine was 1.1 last month.
You're busy. Good job.
I will say that I was doing a 5-day fast, and I was in the middle of it.
Really
but
drove it down.
I'm typically at about 2.2.
Yeah. I mean, the lower the better. The bad part about fasting insulin for uneducated clinicians is the normal range can be as high under 90. I've seen 19.6 or some random number that you're still under normal. which reminds me of the point. These are average of the population, which tells you how bad the population health is. Same thing with liver numbers, like these AST, ALT, these liver numbers. That average has shifted up over the years, again, because they take an average of the population.
So it's a moving target.
It's a moving target. So you have to really understand what it really should be and not fall under the bell curve, So now the outliers to the left is really the healthy ones. And, the more towards the center you are, more unhealthy, like the 88% of the people,
So you said yours is around 2 or 3 year fasting insulin?
Right. Yeah. I've checked it twice. I haven't checked it since, but the 2 times I checked it was 2 to 3.
Because mine flagged it. Mine said it was low of the fasting insulin, like that was a problem because it was under. Maybe mine said 2.3 was cut off. Mine was 2.2 the first time I checked it. So don't Google what happens with low fasting insulin, because then I was.
Then you'll be diagnosed as type 1 diabetic.
Yes, type 1 diabetic and dementia, it said. And what I did was I reached out to Dr. Bickman on Instagram and said, look, you keep telling us low fasting insulin. Mine got flagged. It's under 2.3. Does that worry you? And he said, no, it brings me joy. He said,
and that's the context of matters.
Like, that's right.
An 80-year-old who's having high sugar and insulin of less than 2, they don't make insulin. That's a completely different scenario than you having a 2 because you're eating a certain way.
Yeah. Have you ever do you do intermittent fasting?
Oh yeah. I mean, I do it just because now it's naturally. Before it was initially on purpose, but now, I mean, I don't eat. I almost never eat under 16 hours. Often 18, 20, sometimes one meal a day. But that's just kind of, I'm an intuitive eater right now. But generally, that's how it happens. Yeah. I love fasting has broken a lot of stalls with. I mean, people are so sick sometimes, even when they're low carb, they're doing everything right. They benefit to a certain extent, but everything stops because the metabolism is so broken, and it takes extreme measures of fasting is the best tool to break through sometimes and fix things. Yeah,
fasting is ancestral and magical. I mean, I don't want to overstate it.
It's a default state. We fast. I don't know how long. I mean, I wasn't thousands of years ago. You probably fast a day or 2, and then you feast. You fast and you feast, right. and I actually like that way of eating. So when I eat my first meal, usually maybe a small meal, but generally I feast in the evening. I have my big steaks and whatever I eat, I just eat a bigger portion.
Have you done a long fast before?
The longest I've done is 72 hours, mainly because I don't need it and I lose weight fast and I don't want to lose too much weight. But I've had patients and clients go through longer fasts when they're stuck 4 or 5 days, I
had, and now we feel like it was probably erroneous, but I had a colonoscopy and had what looked like he thought was a precancerous polyp. So you tell intermittent faster, I'm in the middle of a 2-day fast anyway there for the colonoscopy, right? So he said you have a precancerous, it looked like, now he had to send it off to pathology and it wasn't, but it was a good alarm for me. And it was a good, if I could, because fasting's a muscle, and I just was working my fasting muscle. And so I just thought, you know what, I'm just going to do a 5-day fast and see if I can kind of wring out through autophagy and all the other processes our body goes through. But during that time, because I'm also a long-term thyroid patient, I titrate my own medicine, of course, because I think I'm a doctor. I know I'm not. I do not give medical advice, but for myself. So during that, I was on day 4 of my long fast, and it wasn't fun. Like, I'm telling you, I was not high-fiving anybody. My glucose reading, in fact, that morning was like 52. I was just hungry, and I was not hungry. I felt weak. But what happened, that's when my fasting insulin was 1.1. It was really low, but that was just that week. But also the other thing that happens, and I need you to explain this, me's cholesterol went. And is it because the liver's having to push out more cholesterol? It pushes out cholesterol during a fast like that, a longer fast?
I mean, there's a lot of debate about this, unless you kind of have a continuous LDL measurement. But I mean, David Feldman has done a lot of self-experimentation and proved you can affect cholesterol swing by hundreds of points by just fasting and eating carbohydrates and eating a certain way. But I think when you do have long fasts, triglycerides tends to be low, but your LDL, total cholesterol, may skyrocket. And I think that's a lot of it because of these trafficking of these energy molecules. Your energy is coming from fat, and that all these triglycerides and things like that were stored, they're just coming out by the truckload to distribute to the body. And you're capturing that snapshot,
Right.
and you may see a very high cholesterol. It's very debatable. People will call you crazy. People will call you dangerous. And some people will applaud you. So for me, it never made sense. You could be healthy in every aspect of your life, except one thing is going to kill you. And if my body makes 90% of cholesterol, why did evolution or God or whatever you believe in made it happen if it's supposed to kill me?
That's such a good point. That's exact. And for our sex hormones to communicate, we have to have cholesterol.
Every cell, a brain cell, every hormone, it's just I'm thinking of just a simple common sense guy who's not in a medical way. I'm just thinking common sense, because when there's a lot of red herrings out there. I mean, you see things. It's it's a good analogy. I don't know who made it. Maybe Jason Fung. But you have fires. Every time you see a fire, you see fire trucks, and you start blaming the fire trucks for the fire by association. Or umbrellas for the rain, because they always coexist. And it sounds stupid, but that's actually what we may be doing. More rain, more umbrellas, more fires, bigger trucks, so more trucks. So we're blaming the wrong thing, except maybe it's there to fix things.
Do you look at your own cholesterol and go, Or
yes, I have. I mean, to be honest, my LDL is very high, and the first time I saw it, I was freaked out. But then triglycerides is good, insulin is too, HDL gone up. I've always historically had low HDL in the 30s, and it went up to the 40s. It's been a few years since I checked, but my LDL, again, it's not medical advice, but my LDL is upper 200s, and it went there after going low carb. I don't have pain, I don't have high blood pressure, I don't have insulin resistance, I feel amazing. I just not convinced that this is a bad thing. I could be wrong. But.
Well, you're saying, not in a medical, let's take the medical paradigm out of it. Let's go to just common sense. My common sense tells me that there must be a drug that treats that cholesterol. So, let's really look at cholesterol. Like you said, there's no pill for fasting insulin.
Yeah.
There is a pill for your cholesterol. So all of a sudden everybody's.
Yeah. And I don't want to be a conspiracist, but
be one.
You can come up with a lot of reasons. So me as a doctor prescribing statin may be the most innocent of the bunch, because that's what I was taught.
Right.
It's really, you have to go up into politics, into funding of research, into how these companies, derive profit, and and they may not mean harm, but they mean profit, but that they, as a collateral, they hurt a lot of people. I mean, these medications make LDL looks pretty good, looks beautiful, right? Bunch of side effects, but who cares, right? Or
a lot of side effects.
The fact that taking cholesterol medicine when you have never had a heart attack or primary event, there's really almost no benefit taking it. It will make the number look pretty, and that metabolic syndrome by definition doesn't even mention LDL. That's more of a triglyceride issue. Historically, before there were statins, they look at HDL and triglyceride. These are really the better surrogates of risk. Central obesity around the belly, which is visceral fat, high glucose, high blood pressure, high triglycerides. These are the things that really make a difference.
Was it, I think America turned on cardiovascular, our cardiovascular makeup when Dwight Eisenhower had a heart attack. I think that was the beginning of the cholesterol. Well, because he was in the White House, he was slim, but whatever factors contributed to that, nobody knows. It was a long time ago. But I think that's when we started that's when medicine started getting a little more political, I think. and started pushing an agenda. And then everyone said, well, you can't eat shrimp because it's high in cholesterol, or you can't eat. I mean, it was just the most arbitrary, it was the dumbest thing. But we've stuck with those dumb things and then policing the way what our lab work looks like.
Yep, 100%. I mean, at the time, I can see why this happens. Maybe if I was alive at that point and this happens, I mean, simple surface level logic, okay, eat fat, you get high fat, you eat cholesterol, you get high cholesterol.
That's what we thought,
so
right. Mm-hmm.
you cut out an artery and you see the plaque, it's made of cholesterol. So I can see why that initial, that should just provide us with questions to ask and put them to test and hypotheses and do the. But once you make your own judgment and decide that's what it is, and you start looking for data to support your theory instead of being indifferent and find what's the right answer is, then you go down the wrong path.
Well, tell me then, how is cholesterol formed from the liver then? Am I getting that right?
Yeah, I mean, it's made on the liver, most of it, the LDL, yes.
And so we do need it. That's what I'm saying. It has such bad PR, but we do need it for these things to work. But, okay, so you're saying, but the heart surgeon looks at the plaque, and do we know for sure the plaque is always caused by cholesterol?
Well, there's always cholesterol in the plaque and calcium deposits and inflammatory cells.
Okay.
But the cardiologists also know that heart disease is more of a chronic inflammatory problem, and
Absolutely.
they already know that.
Yeah.
And even they admit that a lot of the benefit of statin is not by lowering the LDL, is because it has an anti-inflammatory property, which it does. But happen to be a small effect. And you know what has an anti-inflammatory property? Eating better and removing all these inflammatory foods. But lipids, I mean, you can't live without cholesterol, right? Every cell has it, every membrane has it, every vitamin. But the argument is too much of it is what's causing the problem. Now, it could be the case, I just haven't been convinced. It could be also that the LDL, which was functionally fine, it got damaged by the inflammation and then became more sticky and got into this area and became part of the problem. I can buy that, but then the solution is not to remove the LDL, lower the LDL, because that was never the problem. It's what happened to the LDL. So let's go layer deeper. If what happened to the LDL is a problem, which is inflammation, how can we cut inflammation? And that usually is the diet that we eat has been the major driver for inflammation.
Would you measure C-reactive protein then to kind of also see what was going on?
Yeah, I've been surprised how high the CRP is. There's two CRPs. There's a regular CRP. There's a high sensitivity CRP. Either one is fine, but high sensitivity, it is even more sensitive, and it usually correlates with heart disease. And that's one of the measurements, even in conventional medicine, that's used. I've seen a lot of people with very high, above the cutoff, numbers, and they come down as they fix their health.
Yeah. Well, what number do you like for C-reactive protein then?
I like less than 1.
Less than 1.
I mean, I always strive for less than 1 for the high sensitivity. Less than 1 is optimal. 1 to 3, I think, is just a little bit of risk. Above 3 is bad. But I've had people, it says greater than 10, so I don't even know how high it went, and then it comes down. And these are young people who their own problem is eating bad. They have weight issues, insulin resistance, but joint pains, a lot of things like that. They have very high CRPs, yeah.
So is yours probably point?
I checked it a few times. It's 0.8.
0.8, yeah. Good. Because that, I would think from your perspective, would be have more weight in this game than, arbitrary cholesterol. But it's going to be hard to convince anyone otherwise.
I mean, we're biased. You're biased. I'm biased. Everybody's biased. But my argument, I'd like to believe that I used to be the other way, kind of believed what I was taught and practice it like that. But when it didn't make sense, or my patients weren't getting better, and I got healthier, then I started questioning that, and I started believing the other model, and then when I put it in practice, people are getting healthier. I never take people off medications for 10 years in the hospital. Well, they're very sick there, but even in clinic, when I was in training, you always add medication. But now, my passion, all I do is really just get him healthy and take off the medications.
Isn't that a great feeling? I mean, that is a
great feeling. Yeah. What makes me sad is people think I'm not practicing medicine. Are you sure you don't want to be in medical? It's like, this is medicine.
Yeah.
If I'm not sending prescription to the pharmacy, it doesn't mean I'm not clinically I'm
Right.
not practicing clinical medicine. I'm actually stopping the medication. So,
Well, let food be thy medicine.
yeah.
What is the diet? Do you practice more of a carnivore diet or ketogenic?
I personally eat more carnivore-ish, but I'm not like 100%. I would say maybe 80 to 90% carnivore when I'm eating at home. But I do like, sushi. I'll do like rice occasionally. Occasionally, I'm gonna have a piece of bread, fruit. So I like a little bit of fruit. I've incorporated some fruit, a little bit of honey, if I
Raw
want to
honey.
drizzle
Yeah.
over the cottage cheese. Yeah.
Yeah.
But again, this is not. I don't use that as an excuse to go like overboard with it. So.
In your first journey into weight loss, did you incorporate carnivore, or were you just then cutting?
No, carnivore was the last edition.
Okay. Yeah.
So Whole30, then I did general. Actually, I stopped and I started having back pain again.
Wow.
Like everybody, you stop, you don't know. It's like, oh, okay, I got benefited. I can eat again what I used to eat, and all of a sudden you get a flare up. Then I did just paleo in general. Then I did keto. I did that 3 months straight, and I lost another 10 pounds. So actually another 5 pounds. So by then I was 30 pounds down. And I thought I didn't have any more weight to lose. Well, then I tried carnivore. Then I lost another 5 pounds. So my waist became the smallest I've ever had since I was a teenager.
Wow.
So like, okay, so and that time, what the difference between this is, so we get the low carb. I got that part, but then I still believe too much energy from different sources can play a role to a certain extent.
Yeah,
So
sure.
when I was doing traditional keto to like very high fat, moderate protein, but I flipped the formula with carnivore, much more higher protein and moderate fat. I didn't go low fat. I don't like to go low fat, but that kind of took me to the next level of getting leaner, and I liked it more.
Did you lose inflammation when you went more 80% carnivore?
I know I felt better. I don't have markers to prove what I feel, except my back feels loose. Feel a little lighter on my feet.
You're the study of one. I mean, that's
Yeah.
where we rely too much on numbers, and sometimes it's no, I just feel better, but
Yeah.
there's no reward for feeling better to the medical or big pharma.
Exactly. But I know from my patients and clients, sometimes in the journey, as I take them through the journey, sometimes they get stuck on more traditional keto or some other forms. And I would say, let's try carnivore for a short period of time, just to kind of, clear up some of the inflammation. And that works a lot, and they feel amazing. Some of them decide to even stick to it long term. And some of them find some sort of happy medium.
Now, have you done lab work though, since you've been more strict on carnivore as
I
opposed
have
to keto?
Did I? I don't remember honestly whether it's like when I was keto, when I was carnivore. It's been a couple of years since I.
Okay.
I don't like to obsess with numbers
Yeah,
in general,
right.
because I've checked them twice and they've been good. So,
Yeah.
but I should actually. I've been thinking about repeating stuff just to see where things are at.
Because Dr. Paul Saladino and is Sean Baker the other guy?
Yeah.
Yeah. They both. That's part of their argument is come look at my lab work.
Yeah.
I can show you that eating a carnivore diet. Now, when I first started, and I've only been toying with this for about 4 to 6 weeks, the purists eat beef and salt. Like that was one option. I went, well, I'm going to need a little more than beef and salt.
Yeah.
So have you ever been that strict?
No, I mean I do like beef more, but I'm more of a steak and eggs type guy.
Yeah,
I like some dairy. I do like fish, so I'm more of a animal kingdom carnivore-ish. But generally lean heavily on steaks because I like them more.
Well, since this is my podcast, I can say anything I want about anything, and I really want you to back this up. But I want you to tell me how dangerous vegan and vegetarianism is.
Well, you can be a healthy-ish vegan vegetarian if you do it correctly, but that would require a lot of effort, a lot of supplementation, a lot of really paying attention to what you're doing. And there are a few people who do it, but I think for general population, it ends up being equal eating junk food that is labeled as vegan, and there's a lot of health issues. People argue that, well, they lost weight, they felt better. My answer is duh, because you stopped eating
Right.
standard
Right.
American diet. You can eat anything for the first 6 months and you will feel better. But then a lot of people who quit veganism or vegetarianism is because a year or two down the road they start feeling horrible, hair falling off, nails brittle, mental health issues, anxiety, depression, things like that. So I never recommend it. And people who ask me, I certainly urge them against it. But if they decide to still want to do that, I try my best. First, I tell them I'm not the right person for them. But I still had a couple of vegetarian and one vegan who wanted to still work with me, and I had to learn ways to do make better choices. It was extremely hard because one, it's impossible to avoid carbohydrates, especially one of them, the vegan had diabetes. I'm trying to reverse that. So that was very hard, but we found ways. But then you have become very monotonous.
Well, I mean,
you find
what
this.
No, honestly, I'm sitting here thinking, what are they eating if they're diabetic and they're vegans? Because that's a carb diet,
Yes, so there's tofu. It's a lot of tofu.
which is bad for your thyroid and long term. You know what I'm saying?
Well, I mean, that's and then becomes that's the only option available. Or you pick beans that are lower. Lupini bean, for instance.
okay.
Some people use lupini flour. I had this guy who was just every day he was eating the same stuff. He was happy with it. He was losing weight. His diabetes reversed. I mean, to each his own. But some people are doing it for religious reasons or cultural reasons where they don't eat some things, and that's hard to argue because unless they want to change, it's hard to do it. But generally, I never recommend it. I don't think. But if they're gonna do standard American diet versus that, maybe better start there. At least vegetarian, you can eat dairy and eggs, and you can work with it.
That's true. That's true. Yeah.
So it's a little
Dairy
bit
and
less
eggs.
bad, but there's still heavy dependence. I mean, I have physician colleagues who, they're Indian, they're vegetarian
Right.
culturally,
Right.
and they all have pre-diabetes, and they're not obese, but they do have insulin resistance. They're young and they have early diabetes, and that makes me sad because that's what they eat: beans and
Yeah.
rice.
Yeah. Yeah. And it's a tough argument because it's politically so weighted politically that, oh gosh, you,
Yeah, I mean, people are, there's a lot of, I don't know if you follow me on Twitter, but there's a lot of pushbacks, a
Yeah.
lot of people attacking.
Yes.
And nobody's convincing anybody
no,
about anything because, I mean, including myself, because that's not the way to approach. If you're arguing, you're basically firing squad on, nobody's going to listen. So it's not they're not asking questions. They're just passing judgment and they're telling you that you're wrong, and that's all what they're interested in. So I don't even respond 90% of the time.
all right. Well, hate doesn't motivate us to do anything, but divide us more. And
Yeah.
that's how this has turned. It's like just so many things from 2020 to now. It's just how
Yeah.
divided we are on so many issues. The thing about that Dr. Saladino says, and I think, and Dave Asprey has both said,
So I'm
have
just making
both
sure.
said about, they're both former vegans, and they both say their honeymoon period, and it's exactly what you said. It's getting off Pop-Tarts and whatever else. I guess they can call Pop-Tart though vegan. If you want to look
Yeah.
at it that way.
I
But
used to live on Pop-Tarts in
that-
college.
That's right. Right. I mean, and ramen noodles. I mean,
Yeah.
it's a wonder I'm alive. I mean, the junk I eat. But they said there's a honeymoon period, and then it takes a really mature vegan to say, you know what, this isn't working for me. Like you said, the hair thinning, B12 levels are so low. They're so
Yeah.
anemic. So do you ever see, I mean, can you then, do you think, and just your patients, can you then convince them then to say, you know what, a little pork lard would be good for you and a steak?
I haven't had that many. Again, one vegan to a couple of vegetarian.
Yeah.
But I discourage them from working with me because I tell them I'm going to continue
Yeah.
to advocate animal-based
Okay.
nutrition. You got to tell me ahead of time that I just shouldn't approach it. And if you still want to work with me, I'll try my best. But I know I'm telling you it's not optimal nutrition. So that's kind of weeds out a lot of people who still want to live that lifestyle. So
Yeah, that's a good way to put that, to put the ball in their court, to say this is the paradigm from which I, project. So are you practicing nephrology now, or are you more doing metabolic medicine?
just metabolic, yeah. So when I trained in nephrology, I actually never ended up going into practice and just pure nephrology. One of the reason is, in hindsight, and it's funny because I didn't want to deal with chronic diseases. I didn't want to, like, when you deal with dialysis patient at that point, it's too late. And then that was the bulk of work, is really dialysis unit to dialysis unit, and then just putting people on dialysis. And I see a lot of complications. So I ended up being a hospitalist, which is basically medical practice in the hospital setting. I see a lot of kidney patients. But that kind of opened my eyes to basically almost everything is either directly chronic diseases or complications of chronic diseases. And then everybody was getting sicker and sicker. So,
and the other thing is, we're getting sicker and sicker. I heard Dr. Hyman say in a podcast, a recent podcast, that also, because he was talking about the fallacy of calories in, calories out. But the other thing that we've incorporated is we've had over a 20-year time, or I think the study started in 2000 to now, to 2022, that we really have had lower calories. I hate even using the term because it's so misleading. And more exercise. We have more fitness facilities than we've ever had, but we're the fattest we've ever been. I always say there are fat people on the treadmill at your gym, and they're working hard, sipping on a Diet Coke. And they're doing their best. So how are you approaching? I mean, we know exercise is important. We know weightlifting is important, but how do you get people off that endless cardio train? Because I know it doesn't benefit a lot of people. What's your philosophy on that?
Well, I tell them, if you enjoy your exercise, you still want to run and do that, that's fine. That's your remember, just realize this is for your mental health and physical health, but you're not losing weight because that's how you ended up calling me, because it hasn't worked for you. I don't want you to stop exercising. If anything, I want you to continue and maybe change things up a little bit, but know that 80% of it is probably diet related. Then you get stress, exercise, sleep, all that other stuff. And then they put it to the test, and then they slowly, it's hard to divorce yourself from old belief system.
Oh yeah, for sure.
Even weeks and months down the road, they still feel, well, I need to exercise. Maybe that would help. So yes, it will help you feel better. Maybe you'll make better food choices. But exercise alone, I mean, it does help with insulin resistance, sensitivity. I described that, because we deplete the muscle, with a high intensity. That momentarily, for a couple of hours or whatever, how long it takes, you are more likely to take that glucose into the muscle and then make more insulin sensitive. So in that sense, I tell them, yes, it helps you, especially if you have diabetes. And sometimes they just learn the hard way. They keep trying, and then it doesn't work, and then they work on their diet, and it works, and then they change over time.
I also think too, and I don't know if women are more prone to this, but I do think that there's a cortisol issue in so many women, and I think of both childbearing years and postmenopausal. We're just wired differently, and so it's that woman too. And I remember in the Institute for Integrative Nutrition in New York, one of our instructors told us a story about a gal who was training for the New York City Marathon for 9 months, and she ran 40 to 90 miles a week, 40 to 90 miles a week, and handed in her food diary to her health coach, who is PhD in biochemistry, I think. And in that time, in that 9 months, I hope you're sitting down, she gained 26 pounds. See, her body was saying, stop. But we, like you said, we have messages that told us, get on the treadmill, get back out there. And she couldn't figure out what it was. And it was the instructor had she was both an instructor and a health coach. At that point, she was her health coach, was saying, well, maybe it's something, less is more.
Yeah, we got to rest. I drive that. I mean, a lot of people, I have people who over exercise, and I tell them, I'm not telling you don't exercise, but you need to break. You need a day or two break a week, just recover, heal, sleep. But yeah, women is the physiology of women is so more complicated. Men, they do one thing and just kind of it works. And then
And you know
women,
we hate you all for that.
yeah, I know,
Okay,
I know.
just so that we're clear.
I'm working with a client whose husband just copying her, and he's down like 20 pounds in a month, and she's like 5 pounds or something like that.
Gosh.
And then she's like hates him. So that's because there's stress, cortisol, not sleeping, really doing more than men at home with kids, and there's a lot of more stress, and they tend to be more emotional eaters, even if it's good food. I mean, can't tell you how many times I have to take nuts away from women because nuts I've come to realize is not good for you in terms of losing weight.
Yeah. Well, but that's more of a keto principle, right? Nuts are in the keto.
Well, I was talking like the emotional eating, like if they were eating carbohydrates and they replaced it, they usually, they don't replace it with broccoli and steak. They replace it with nuts and cheese. And then it's easy to, nobody eats one almond, usually just to grab a bunch.
That's right,
and then and every time there's weight stalls, they're not eating any carbohydrates. But then we take away the nuts and restrict the cheese and increase other stuff and things start falling. But then that falls into, they have to work on the emotional part, like what's taking them to those nuts, to deal with it on their own, with a therapist, with me. I mean, I feel like a psychotherapist half the time.
Because food is very emotional.
Yeah.
And our culture, I mean, come on, rewards us. It's your birthday, let's have cake. You finished a project, let's have cake. So
you're angry, let's have cake. You're
that's
stressed,
right.
You're
and then
upset,
drink, right. And then the combination of that. So what is your position? What do you think is best for us with alcohol?
Well, I prefer zero, but I understand it's not possible. I always tell people just whatever you do, don't drink beer and don't drink mixed drinks. So if you would do a glass of wine or liquor like tequila, vodka, things like that once in a while, I think that's okay. Maybe ranch water rather than anything mixed. So people who still want to enjoy it once in a while, it's fine. But I have people who drink, let's say, scotch every day. That becomes an issue. They can't lose weight even when they're eating clean. Still a lot of energy coming in.
Yeah.
So I don't tell people, I don't drink much. I don't care for alcohol. When I do, it's very rare. So it's hard for me to see it from their perspective, but I try to work with them. But I have people who completely gone from daily drinking to nothing, and then they don't want to drink. So I have a woman who started drinking again just for social, had one glass of wine after used to drink a bottle, and she felt like terribly at night, couldn't sleep.
Yeah. Oh, for sure interrupts your sleep. It's just, it saboteur is what it is. I kind of think, and I'm just saying this again, study of one, since I've incorporated carnivore. So I tried keto a few years ago before I started fasting. My son was in college and he was telling me about keto. So I tried that, didn't really have results. And I don't think my hormones were right. I was not sleeping enough. I was getting up because I was on morning radio. So I was getting up super early. So I think all those things played into it. Well, now I can sleep better and all these things, and all to say that going carnivores made it so that I don't miss alcohol. I don't miss carbs. I don't know if there's a satiety factor with carnivore that I was keto. I felt like I was missing corn chips. I don't feel that way now.
Yeah, it's the protein, honestly.
It is the protein. Okay.
The animal protein. I mean, I feel it myself.
You know what I'm talking about then?
Yeah, I know exactly what you're talking about. The days that I undereat by accident, I'm looking for the wrong stuff. Mm-hmm. So, and every client, like they're seeking carbs, or bad fats, but they're not eating enough protein. What's enough? They think they're eating enough, and that's the thing. It's just they need so much more than when they're eating. And then carnivore, it puts you there. When you're just limiting your options to just meat, you keep eating until you're full. It's a whole different level of satiety, like the level-headedness, the comfort, the feeling of ease, the lack of cravings. That's keto didn't do that for me either. Just traditional keto. Carnivore, you are keto. It's really about eliminating the carbs,
right?
But it's just a lot more protein than before.
Okay, because it's really much more drastic as far as a diet, carnivore, but it's easier for me to maintain. I don't have the cravings. I didn't understand why. Yes. But it's the protein.
So there's no willpower needed after that.
No. So, the other thing that Dr. Fung kind of started me on, and I tell my clients, but it's so easy with carnivore, is no snacking. So, we send kids to school now, as you probably know, that they have, often we feed them breakfast at school, then we feed them a snack, then we feed them lunch, then we feed them another snack, and then they come home and then they're sipping on something all afternoon. So their insulin has been pumping out.
It's a roller coaster. I call it's a roller coaster. And no wonder they have, we call them, they're just having behavioral issues. They're just, they're victims of what we're doing to them or how we're feeding them. And you see kids, sometimes their parents or really do the work with them and they fix their diet and their kids become much calmer, much more normal behavior. They're still kids, they're going to have issues, but, it's much easier. Yep. Snacking is, so I have two rules for people. One, you got to keep eating until you're full and focus on animal protein, even if they're not carnivore. And two, you do not want to snack. So, and that's important.
That's the exact opposite advice from the last 30 years. We were all told to keep our metabolism burning was to eat 5 times a day. So I obediently did. And I was hungrier then than I've ever been in my life.
Of course. Because your insulin is high. Because those snacks were carbs generally.
Yeah. Oh, yeah. Or I would run for a handful of nuts, but I just couldn't get satiety like I can now. Now, Dr. Fung did explain in one of his books. So he says we're hormonally driven to eat, right? And insulin being the chief hormone, and then he talks about obviously ghrelin, leptin. And then he does a deep dive and does cholecystokinin and YY peptide. And he says those don't fire. So if you start looking at it, if you can be objective, those satiety hormones don't fire until you've had fat and protein.
Yeah, absolutely.
So that's why people will always say, well, I can't do so-and-so. I'm having a hard time maintaining. Now I'm understanding my paradigm shift is, have you had fat and protein? No, because I had a salad, which now I wouldn't eat a salad if you had a gun to my head. Not interested. Right.
Makes me mad.
It does make me mad.
Because I just get tired from chewing. I get bloated from all these fiber in my stomach.
And the anti-nutrients that are in whatever you're eating.
Yeah. So, but there's room for them. There are people don't have affected. Some are affected more than others. But I always tell people, if you're gonna snack, make it a protein. Always have a protein, no matter what, whether it's a snack or a real meal. And that's why you eat less because you get full and you activate all these hormone cascades in the right places.
Well, that means then we've also changed what we used to tell our kids was just grab an apple and have some grape juice in the afternoon and you'll be fine. No, that's the last thing you need.
The worst thing we can do.
But we used to do that. We used to think an apple, just eat an apple, you'll be fine.
Yeah. Well, when apple is half the problem, at least it is kind of filling temporarily, but just that apple juice or whatever juice, it's just horrible.
Yeah. Yeah. Now that we know that insulin, though we need it, it's a double-edged sword. Insulin. We need it, but it's killing us.
Anything in excess, it's supposed to be on-off for brief moments.
Oh,
but it's on. We keep dialing the volume throughout the day. And then that's why people are not very hungry in the morning a lot of times, because their insulin is at its lowest. And the minute they start eating carbohydrates, it starts spiking and then overshooting, and the sugar overcorrects. And then you go through this roller coaster of hunger, cravings, things like that.
So in the morning with the dawn effect or the dawn phenomenon, when we have that glucose spike. So when our glucose comes up, and ours probably doesn't that much, but traditionally people, because I did the CGM and it was like 105. Maybe once, I can't even remember. But when our glucose comes up, is insulin triggered then to help bring it down in the morning? Does insulin come out at that point?
I don't know for sure, but I know it's driven cortisol, which is drive glucose. But that would make sense that it would come up. But I don't know honestly what happens at that time. But I know the hunger is the lowest. But the people that have the more pronounced dawn phenomenon, they tend to be hungry more because they're still metabolically in an unstable way.
Okay.
So yeah.
I'm asking selfishly for a client of mine who just said, well, I'm still having a little hunger in the morning and my glucose is up. And it made me think, I wonder if her glucose is signaling her pancreas, is signaling that her insulin needs to bring it down. Because she said, I just drank black coffee and I drank water and I got over it. And I said, I think it was probably the cyclical nature of your glucose coming up and then coming down. But I'm not a metabolic scientist.
Yeah, but if you resist it and eventually cortisol is going to drop, then the glucose is going to follow. But a lot of people who have that problem, I tell them early on, just eat. But eat protein.
Okay.
Actually, the glucose drop right after. But then eventually they get used to it and they slowly go back to 2 meals a day. So it's hard to go intermittent fasting when you're still so carb, sugar driven.
Yeah, it's kind of... My story is that my son's the one who told me then, the guy who was doing keto told me about intermittent fasting. And, they're really, it was in the infancy of Jen Stevens, and she had a podcast, but maybe she had a book she had written. And Dr. Fung was just coming out of the woodwork, 2017. But in that, my son just said, because I'm such an easy sell, he said, well, just start tonight. This was at 6:30 at night. I said, so what do I do? And he goes, well, don't eat again until tomorrow at 12:30. So I just rip the Band-Aid off and did 18 and 6. Yeah. And you know what? I did not die. I mean, look at me.
No, right.
I'm
Nobody
still
dies from lack of
I did not die. But people have this fear that they may have hunger. And they're like, I can't do it. And then once they do it, they go, it really wasn't that bad because the hunger
wasn't that bad.
The hunger went away.
It's mental.
Yeah, totally mental.
It is mental. The first few fasts are mental.
Okay, tell me then what you do. So you are offering metabolic services that nobody's doing. I mean,
there are coaches and there are doctors, and I feel like I'm a marriage of both.
You really are.
And it's kind of happened just how it evolved, and I moved away from conventional medicine. So right now I work from my home, and then I deal with clients or patients. And then depends but usually I focus on metabolic health, obesity, diabetes, and it comes with a package of fatty liver and high blood pressure and things like that. So coach them like any other coach. So most of it is really intensive coaching, but I have the luxury also in states that I'm licensed in to also adjust the medications myself with them with their permission, and really have people come off 7 drugs.
Awesome.
It's beautiful. I love it.
Well, here's one question that I keep getting posed by my clients, because obviously I don't give medical advice, and they have a healthcare provider. My healthcare provider's putting me on Ozempic or semaglutide. What is your opinion on those that are really type 2 diabetes drugs? So my question is, does it permanently affect their body's ability to be leptin sensitive?
Well, they work on making you feel more satiety.
While you take the medicine, though.
While they take the medicine. I'm not a fan of drugs as the approach, but some people, if they need that push to get there, but they still have to change their behavior. So whether it's a pill, a shot, or a gastric bypass, if you're not changing what you're eating and how you're eating and your mindset about it, you're going to gain it all back. So
it can be a Band-Aid.
Yeah, it's always a Band-Aid. Yeah, they have to change.
But so that's what. So we don't know if it then affects their leptin, YY peptide, cholecystokinin.
I don't know.
Long term.
I'm sure. I don't know. It can't be long term because it's by nature a short term drug will last 7 days usually.
Oh wow, yeah. This is a big go-to for a lot of healthcare providers. And I do think, I do have the empathy that the patient's going in there going, well, I've tried everything. And some are even saying, I've been intermittent fasting and I'm not getting results. This helped me get results.
Yeah. I mean, people who are already on it, I don't stop it right away. I'll piggyback and use to get the benefit. Eventually, I'll stop it because there's not a lot of risk involved. It's a good drug. But I always tell them I don't want to start it for that reason. So.
Well, would you then tell people to take berberine, which is the over-the-counter glucose mitigator?
Same concept.
Yeah.
If it needs a little push, I'm not big on supplements, honestly.
Yeah.
Except magnesium, salt, and some vitamin D.
I love magnesium.
Yeah, magnesium, because people really cramp up and I need to supplement. But I really think if they're eating a full diet, they're getting most of it. Now, a lot of people disagree with me, and there are used for some supplements, but I don't trust most of it what's out there. So
I'm voting for you for president or whatever. If you run for dog catcher, I'm voting for you. Great job.
Right.
You're a great interview. I love your social media. We will link
thank
that
you so much.
In the show notes. We'll link all your social media because you're not afraid of the big bad wolf, and I love that. So good job today.
Thank you so much. Thank you for having me, Lisa.
Oh, thank you for being here. Good job.
All right.
Thanks for listening to the Lisa Fischer Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fischer Said podcast is produced by ClantonCreative.com.